wouldn't we, Janet? But it's good to have company. Um, so we're going to run through what a pelvic floor is and what it does and why having a good one is smashing. And I've got some screen sharing to do, but I am pretty much stuck in 2018, so I'm a little bit nervous about whether the tech works. So I'll attempt this. Yay. So that's what you had when you come in. Now, the QR code that's on there, if you click on that, it'll take you through to the pages on the website that you can download some paperwork that I'm going to send you will be useful as we go through. So the anatomy that we'll talk about, I've got a handy wee model here. So this is a model of your pelvis, and it's going fuzzy, isn't it, with the background being blurred out. Um, so the red bits are the muscles, and there's blue bits on the back, which are ligaments. And then the pink bits should be vaguely familiar because you're either sitting in a vulva or you maybe came out of one. Um, that's like modesty blurring, like they do on Instagram. Now, the way that the muscles are arranged is really important when it comes to pelvic health and the sort of symptoms that women have, because it's quite complex. There's three layers of the muscles, and they all do the same thing. So their job is to squeeze your holes shut and to lift to support your organs. They attach from the bone at the very front of your pelvis. That's annoying, isn't it, with the background? Let's see if I can get rid of it. Um, there. So the bone at the very front of your pelvis, and then they attach on your tailbone at the back. So they make like a little hammock. And Lucy Brett wrote a book called PMSL about her experience about being incontinent. PMSL, or how I literally pissed myself laughing and survived the last taboo to tell the tale. And in her book, she says that your pelvic floor holds up your whole world, which I thought that was a really neat way of explaining it, because if there's a problem with your pelvic floor, it interferes with absolutely everything that you want to do. Now, the pelvic floor isn't fixed like a floor. It moves up and down as you breathe. So your diaphragm at the top is moving up and down as the air's going in and out of your lungs, and your pelvic floor goes with it. So it's really important that your pelvic floor can contract as well as relax. And their job is, I'm going to show you another screen share. So what their job is this. So they create a little hammock going from the wee white bit at the front is the bone at the front of your pelvis, and the one at the back is your tailbone. And that little sling is supporting your bladder at the front and your vagina and uterus, if you still have one, in the middle, and then your rectum at the back. That's their job. They stop those organs from, well, frankly, falling out. So their main job is to support. They also have a job to keep your holes shut when you want them to be shut. So some of them form a little circle to make a sphincter. And if a woman has a childbirth injury, if she's a third or fourth degree tear, that means that the tear has extended down into that muscle mass, into the ring, which can leave her with problems, which is why women would go for a surgical repair of that. So they hold your bits up. They support, sorry, they give you controls so that you can squeeze your holes shut. They also have to be able to relax so that they can open so that you can pee or poo, or, if it's the weekend and you're sexually active, you might want something to go in. And they've got an important role in your sexual function. So muscles that don't relax properly can cause pain on penetration. Lots and lots of women have painful sex, and can be related to their pelvic floor function. And an orgasm is in part a flickering contraction of your pelvic floor. So the stronger and more coordinated your pelvic floor is, the better your orgasms can be in theory. There's not gold standard evidence for that, but that's just because they haven't actually done the research rather than anything else. So, do your own your own study and see what happens. Now, as well as sorry, I'm going to share my screen again. As well as the muscles holding the things up, it's not just muscles that do this. There's also sort of gristly stuff in that pink bit that's the actual muscle tissue. There's a heap of gristly stuff that's scaffolding to keep those organs in place. So that's, see, this is where it's going to get messed up with my screen sharing. That's me saying that your pelvic floor goes up and down when you breathe. So when you're taking a deep breath in, it descends, and when you're sighing out, it rises up. And function, here we go. So your muscle hammock, and this is pointing at your bladder. So the arrow is pointing to the first organ that's in your pelvis, which is your bladder. And if the scaffolding isn't holding it up properly, then the the organs can shift slightly. And that's what vaginal prolapse is, that these three organs aren't being held in position by the muscles and by the gristle. So a prolapse looks like this, where there's just a bit of a shift, and in this case, the bladder is leaning backwards into the space that is into your vaginal space. Now, lots of women have got prolapses. The data says that about 50% of women over the age of 50 have got one. There's some people in the United States that think it's essentially normal for a woman that's had two pregnancies and two vaginal deliveries to have a bit of a prolapse. I wouldn't go as far as to say that it's normal. I think it's just really common, and if it's managed properly, then it's not necessarily going to cause a problem for that woman. The symptoms of prolapses can be really mild. We don't know why, but some women can have quite a small deficit, but it gives them a lot of jip. And other women can have quite a big shift in the organs, and they have very few symptoms at all. It's a bit of a mystery about why that is. However, the symptoms that women will complain about are that they get a feeling of a lump. They might describe it, they feel like they're sitting on a golf ball, or they get a dragging sensation, particularly towards the end of the day. And that's usually because the pelvic floor muscles are working and they're doing their job to hold all of these organs in place. But by the end of the day, they're starting to get tired. And so the organ's shifting and dragging, and you're going to feel that. Sometimes women can have difficulty peeing or pooing because if the organ has shifted, then all the tubing to get to the outside can be affected by that, and they might have to strain to get pee to come out, or poo just gets stuck. It's really difficult for them to get it out of their body. Now, you can't fix this scaffolding that's holding all of these structures in place, but you can give it extra support around about by improving the function of the pelvic floor. And that's what physio does. So there's gold standard evidence that you can maintain a prolapse and stop it from getting worse and reduce the symptoms that the woman's having by doing pelvic floor exercises. And that's really important because your pelvic floor has got to work for the whole of your life. It works from cradle to grave, puberty to grave. And the challenging times in your pelvic floor are at puberty, where sometimes girls they stop participating in PE at school, partly because they're wetting themselves if they jump, or sometimes they're having giggle incontinence where they have frank urine loss when they're laughing. And it's important those girls are picked up, because if you drop out of exercise about the age of 14, you're unlikely to ever go back to it. And also, they're more likely to develop sexual dysfunctions like pain and penetration and pelvic pain. So I'd really like for PE teachers to get this as part of their training, because they're the ones that are going to notice which girls need to get referred into clinic. Pregnancy, obviously, your pelvic floor's got a lot more to do when you're pregnant because it's got more weight to lift. And then during labour, the baby's going down through your pelvic floor muscles, and they do, relax and allow the baby's head to pass through it. But sometimes if the woman has a tear, then you're left with an injury. And an injury to a muscle in your pelvic floor works exactly the same as it does if it's in your thigh or in your calf. It just needs to have, rest and repair time. But you can get scar tissue developing on there, which can sometimes later on cause problems for the woman with her sexual function and pelvic pain. The other thing that pregnancy can affect is your abdominal muscles. because obviously as the bump gets bigger, the muscles stretch to go around it. And sometimes in women, the muscle bellies don't come back together properly. It's called a rectus diastasis. Again, it's really common and usually it corrects itself quite quickly. But if it doesn't, that's our job. Um, that's important that it gets picked up because your pelvic floor and your abdominal muscles work really closely together to help support, make your core work properly. And if your core's not working efficiently, it increases your risk of developing a prolapse. So if women are left with a gap in their tummy muscles, we really do want them to be seen. And then at menopause, as your loss of estrogen starts to affect your ligaments, then that can affect your pelvic floor. Because remember, I said that these are ligaments that the muscles are attaching onto. So as you get older and the ligaments are being affected by the loss of estrogen, they stretch slightly. So instead of your muscles being tucked up where they belong, they swing, your sweet chariot dangles a wee bit low, and you can get symptoms, which can feel really unfair if you're not a woman that's never been pregnant and then you get to your 50s and you start being incontinent, because that's usually a thing that's associated with women that have had multiple pregnancies. And it's true until you get into your 50s. Menopause is a great leveler. And then in women, when they're older, elderly women, it's really important that their pelvic floor is working. Being continent is the biggest indicator of quality of life in older women, and an awful lot of them have got old injuries, old birth injuries, or they've just been a bit leaky and they've managed it until they've got into their 80s and then it's starting to cause them a problem. So I've got a picture of, oh, here we go, share. I'll get slicker with this. So that's a picture of the abdominal muscles that have separated. They don't actually separate. It's like there's a bit of gristle in between, but it can cause a bit of a gap. Now, if the women that have got this, the reason that we want to pick them up is because if women wet themselves during the first 6 weeks after having had a baby, it's likely that she'll still be leaking when the baby starts high school. So, like, we want them to come to clinic. The evidence is really strong on this. If the woman does something about it, it's her leaking is likely to resolve. And if she doesn't, then it just continues and it can worsen over time. And that's the problem with that is it starts to interfere with everything that you want to do with your life. Lots of women find that their thoughts are dominated by what their bowel and bladder is doing, that they change the way that they travel, they change what they wear and how much they drink in order to try and reduce their leaking, which is really frustrating from a physio point of view, because if we were better at telling you how to manage these things, you'd just be able to, sort it out yourself. Now, with menopause, you get a thing called vaginal atrophy, which is to do with the loss of estrogen. If you have got menopausal symptoms and you're under 45, then the care pathway says it should be offered HRT. But systemic HRT isn't going to address vaginal atrophy directly. Vaginal atrophy is just the tissues that surround your genitals and your reproductive organs are really thirsty for estrogen. And if they don't have them, the tissue thins. Now, that can become a problem because you can get vaginal dryness. Your urethra, so the tube that goes from your bladder to the outside, actually widens because the tissue around it thins. So if it's wider, it's more likely that bacteria can get in there. So it increases your risk of getting urinary tract infections. And the other thing is that it makes all of these tissues very dry and they become itchy. So for older women, it can really interfere with their sleep. And that's a massive problem because if you're getting up and down to go to the toilet and you're uncomfortable because you're itchy, then the amount of sleep that you actually get reduces, and that can affect your balance when you're out and about during the day. So there's a link between vaginal atrophy and falls. And there's a move to try and encourage women to educate women about this and get more of us using localized estrogen. It's a little pessary that you would use and some cream. Your GP will know which one is appropriate for you. On NHS England, you can get it over the counter now from the pharmacy, which is because it's really effective, it's very cheap, and there's very few side effects. And it's suitable for women, even women that have had estrogen-driven cancers. So if you've had a history of breast cancer or endometrial cancer or ovarian cancer, your oncologist will clear you, but the majority of women can still use vaginal estrogen. Um, it's yeah, we just need to get more. We need a public health campaign actually to try and spread the word about this. So, bladders, what they do. So, your bladder is like a water balloon, and your kidneys produce pee. And over time, your bladder fills up with the pee. When it's about halfway full, it sends a message to your brain to say you need to go. And you should be able to wait between 2 and 4 hours between first feeling the urge to pee and actually being bursting, which is quite a long time. And then when you go to the toilet, your bladder, there's a muscle in the wall that should contract and completely empty your bladder. And then it starts again. Normal is peeing fewer than 8 times a day and 1 time at night. And you shouldn't leak ever. No leaking is normal, not even a little bit. Sometimes in clinic, I'll ask a woman, like, how much are you leaking? Because the volume matters. And the reply that I often get is just the normal amount, because there's this myth that if you've had children, if you're over 70, if you do a lot of exercise, well, it's just what happens. And that's categorically untrue. Nobody should be wetting themselves even just a little bit. Now, there's two main types of incontinence. The first one is called stress incontinence, and it's the common one. So it's the one where you wet yourself just a little bit if you laugh or cough or sneeze or run and jump. And it happens because the pelvic floor muscles aren't strong or coordinated enough to cope with the stresses that are coming from above when you cough or sneeze or below when you run and jump. The urgency is when is from an overactive bladder, and that's when you have to go, but you have to go now. There's no wait time. So remember I said you should be able to wait between 2 and 4 hours. Some women have no chance of that they get very little warning that they actually need the toilet. It's really common when you put the key in the door that suddenly you're bursting for the loo and you didn't even know you needed a pee until you tried to get into your house. And then there's mixed incontinence, which is symptoms of both of them. Now, what a lot of women do when they get a bit leaky is they worry about it and decide to address that by never drinking anything again and going to the toilet just in case. Now, logically, that makes sense. So if you reduce the amount of liquid that you're drinking, then you're not going to need to pee so much. And if you go to the toilet frequently, then you're carrying less volume, so you're not going to wet yourself so much. But your bladder works on being able to fill itself up and then completely empty itself. And if you go to the toilet before it's halfway full, then it's not going to send that message to your brain to say you need the toilet shortly. And the actual capacity of your bladder changes, it reduces. So normal is sort of about 300, 350 millilitres of pee would be kind of average expected for most women. So if you're going to the toilet when your bladder's only, 150 mils of urine full, then the muscle in the wall will accommodate to that. So then you can't hold as much pee as you would have if you hadn't been in that habit. Now, the good news is that physio is really effective. Well, not even physio, pelvic floor exercises is really effective for stress incontinence, the common one. There's good evidence that if a woman does pelvic floor exercises 3 times a day for 3 months, about 3/4 of them will get dry. Not just, a bit better, but actually completely resolved. And of the ones that that's not going to work for, if we can get them to come into physio clinic, 6 sessions of physio cures 83% of women with that presentation. So there's really no need for so many women to be leaky. It's about 60% of us will experience this at some point in our lifetime. It's really common. Um, Now, I find that very frustrating because we just don't have the public health campaign to tell women about it. The care pathway is really clear, and you should already have got this information if it's new to you, especially because the World Health Organization said in 1996 that incontinence was largely preventable. You'd really think that we would have done something about it by now. Now, I said about how lots of women they start reducing what they're drinking, and that becomes a problem because concentrated urine is in itself a bladder irritant. So it sounds a bit counterproductive, but please don't reduce what you're drinking. Just keep an eye on what you're actually drinking because some bladders are sensitive to some types of fluid. So water is great, but it's a bit boring to drink all the time. Caffeine that's present in tea, some herbal teas, so green tea has got a lot of caffeine in it, and coffee and Coke and chocolate, unfortunately. Always feel really mean saying that out loud. Is a really common bladder irritant. Other ones are alcohol and fizzy drinks. Some people are really sensitive to even like carbonated water. If they're drinking soda water, that can be enough to make their bladder a bit twitchy. Um, we don't know why, but some people are super, super sensitive to caffeine, and other ones doesn't bother them at all. Some people are so sensitive to caffeine that even drinking decaf tea and coffee, which still has a tiny amount of caffeine in it, can irritate their bladder. The way to work it out is just to experiment with it and see what works for you and what doesn't. There is some evidence that for older women, swapping to decaf tea and coffee by the afternoon is a good idea because it seems to reduce the urgency that they'll feel. Now, having said that about coffee can be really useful because although it can be a bladder irritant for some women, it's definitely a bowel stimulant for most women. And constipation is a big problem for prolapse. It's the biggest cause of prolapse. And if you're constipated because of the anatomy, then your rectum's sitting very close to your bladder. And if your rectum's full, you're gonna, that's gonna nudge in against your bladder and that can irritate it in itself. So a morning coffee can be really useful so that you can have a poo and reduce the stress that's on your pelvic floor. Lots of people aren't that engaged with how much pooing they're actually doing, so I want you to pay attention to it. So normal is pooing anything from 3 times a day to 3 times a week. It's very individualized, but you need to know what your normal is and then know if it's changing and what your type of poo is. So there's this brilliant thing called a Bristol stool chart, where somebody a long time ago did their PhD categorizing what poo looks like. And this is one of the things that I want you to download and put up in your bathroom. It's one of the most useful things that you can do for your pelvic floor is start looking at your looking at your jobbies. Because that's how you know if you're constipated or not. Lots of people can have a poo every day, but the stuff that they're actually producing is very dry or pelleted. Other people can have a decent poo, but it's quite small, so it would give us a clue about what's happening with their pelvic floor and whether they've got a prolapse. So what we want to know about is what does it look like? How often are you pooing? And are you able to poo without pain or having to use props or fingers or anything to help shift that? We do get quite direct when we're asking you questions about these things. So the question becomes like, why does this matter? Like, who cares if we've got all of these women? So up to 60% of us wetting ourselves, it's about 1 in 10 that have got problems with their bowel control. And the answer is because that incontinence impacts on your quality of life more than diabetes or asthma. So women who leak, they've got a higher prevalence of anxiety and depression because this interferes with everything that you want to do. It affects what you wear, how you travel, interferes with your sex life, interferes with your sleep. Women give up exercise and it affects how they feel about themselves because we've got we've got a basic need to be clean and dry. And if you don't have that, then it affects your sense of dignity. It's a fundamental requirement of being an adult. If you've been continent, that you maintain it. It's really important to us. Now, we've had the solutions to this for lots and lots of women for about 40 years. We just haven't told you. So let's have a look at good news about what you can do to help yourself, which is, well, we'll start off with doing your pelvic floor exercises. That's the QR code again for the downloads that you'll get. So, do you remember I said that the action of your pelvic floor was a squeeze and a lift? It does both things. It squeezes your holes shut and then it lifts up to support your pelvic floor. So, what you're aiming to do is exactly that, just both of them. You have to feel both aspects of the contraction for it to get the best efficacy. And somebody did some work looking at what the best command was to try and get the best contraction of the pelvic floor. And they came up with being told to hold in a fart gets the best contraction for the most number of women, which makes total sense because everybody knows what that feels like. You've all been in a situation where you can feel a wee fart brewing and you know it's absolutely not acceptable to let that out. So you're going to squeeze your holes shut and lift them up by imagining that you're holding in a fart. Shall we have a wee go? So you're going to take a deep breath in and then sigh out and squeeze and lift your bum hole for 10, 9, 8, 7. Keep breathing. You've got to keep breathing while you're doing this because remember your pelvic floor goes up and down when you're breathing. And then relax and it should go. You should feel something let go. Now that will help you buy more time if you're in a queue for the toilet, but it won't help you if you laugh or cough or sneeze. For that, you need muscles that can coordinate and then relax. So this one is imagine that you've got a fart coming and you know it's going to be horrible, so you hold it in and then it goes away. So you relax. So it's going to be, oh, that's going to be horrible. Oh no, it's all right. It's gone away. And you do that kind of 10 times in a row at this sort of speed. Like, so you're looking for a hard, tight contraction and then complete relaxation. And you do 10 in a row. So it's a hold for a count of 10 and 10 quick flicks. And you want to do that 3 times a day until you're dry, and then once a day, every day until you die. We won't pee with the 10-10-3. That's how to remember it. So this is in one of the downloads, just how to do the exercises. Now, if it hurts or if it doesn't work, then we want you to come to clinic because not all problems are related to pelvic floor weakness. Sometimes it's that the muscles aren't relaxing properly. So we don't want you strengthening muscles that don't know how to relax. Remembering how to do these is really difficult. So if you follow me on Twitter, I'll nag you. There's some really good apps. Squeezy's a very good app. Lots of women, if they've got a smartphone, they set timers and they set alarms, all sorts of things. So trying to do it 3 times a day is the aim, unless it hurts or you've got lots of pelvic pain or you've got pain if you've been sexually active, if you've got pain in penetration. There's loads of reasons why pelvic floors become non-relaxing and physio can really help with it. Don't do the pelvic floor exercises, try this stuff instead. So we want women doing deep breathing to try and get the muscles to lower down. And some yoga and Pilates positions can be really, really helpful. These exercises aren't going to work for everybody. So if you're not sure, then come into clinic. Asking for help can be a challenge because there's a lot of shame and stigma that surrounds these conditions. So I've got a form that you can use to help ask your GP for assistance with this. And it's just a list of symptoms that we commonly see in clinic. And the GP can refer you into the NHS or come and see us. And what physios tend to do is we've got a lot of time. So we've got plenty of time to ask you impertinent questions and jigsaw together what the problem is. we're experts in anatomy and form and function, and pelvic floor muscles behave exactly the same as any other muscle. So what I want you to see is that physiotherapy for pelvic floors, it's not just Kegels. There's lots of things that we can do to do with posture and pain management and, muscle injuries and sleep. Um, that we don't want you to put up with it. The aim is always to get you back to living your life without your bladder or bowel or pain dominating what you do. A wee lady here is holding up pads. I don't have a problem with incontinence pads. They're good products. Like they let women get outside without crying. I have a big problem with the way that they're advertised because they're advertised as if they're the solution, which they're not. They're a tool to help manage symptoms. And since 2011, sales of adult products have outsold baby nappies. This on a condition that World Health Organization said in 1996 was largely preventable. It's kind of immoral, I think. So these are the downloads that will be available on the website if you follow the QR code. And please don't put up with symptoms. Get some help because you really don't need to tolerate the dreadful intrusion that this stuff brings into your life. Thank you very much for
Okay.
listening.
Thanks,
And
Elaine.
what are the questions?
That's brilliant. Thank you. That really, really was informative. I've got lots of questions and I'm just
Great.
looking at the time, so I'm keen to get through as many as we can tonight. So, first one I've got is from Lynn, and she's saying, I've just had a hysterectomy, leaving ovaries, and I'm worried about pelvic floors and whether I'm doing them correctly. What would your advice to Lynn be?
So try doing squeeze and lift. The squeezy app's very good. It'll help you go through as well. Some women find it difficult to know if they're doing them correctly because it's not as easy as exercising your arm because you know what your arm is and what it does and whether it's working properly. You can have a look. If you get a mirror and do a pelvic floor squeeze, you can see the skin changing. You can see your vulva lift up slightly. But if you're not sure, then come to clinic because we'll be able to tell you.
Great. And then I've got one from Shamela. What exercises can I do at my desk? I sit at my desk most days. I've had two babies, one section, one natural. I'm 42.
You can do your pelvic floor exercises in sitting. It can be really helpful because you can feel like yourself lifting up almost off of the surface. Sitting in a hard chair can help women get a better feeling of it. Some women sit on these balls instead of on a chair as well. That can be helpful too.
Okay, great. I've got one from Val here. Full bladders all my life. I have weed most of it out, then have to sit on the loo and wait a few minutes before the last bit comes out. Is this normal?
It's common. Um, Now, it can happen because the muscle in the bladder isn't contracting sufficiently well to completely empty your bladder, and there's lots and lots of reasons for that. What we would advise is probably what you're doing already, that you would do your pee and then wait for a bit, a count of 10 and see if any more comes. If you're not sure, then pressing in on your tummy or bending forward, like you would do in the crash position in the aeroplane a couple of times can be enough just to help get the last bit out. But you should know why that's happening. So it's probably worth following up with your GP.
Okay, I've got one from Lisa here. What would you suggest to help a bladder hold more? I've been told I've got a small bladder and generally hold 50 to 75 mils. Bladder diary done.
Oh, well done, you. So again, it depends on what the cause is of a small bladder. Some women do have a congenitally small organ, but what if there's nothing like that that's at the root of it? Just drinking. Keep going with your bladder diary. You know how much that you're drinking and increasing the time that you wait between drinking and peeing. So when you first feel the urge, trying to wait a wee bit longer, and then over time that should increase your bladder capacity.
Okay.
Yeah.
Okay, another one here. Can HRT testosterone help in menopause?
Well, that's the big question. Anecdotally, there's lots of women say it does, but there isn't the published evidence at the moment. So the NHS won't prescribe testosterone routinely for women. Um, ovaries produce testosterone, small amounts of it, so it would be reasonable to have that in HRT as routine, I would think, but I'm not an endocrinologist, so there is work going ahead. At the moment, the NHS will supply it if you find that your libido has been affected by your menopause. So have a look on Dr. Newson's website at Menopause GP. She's got some good information on that.
Okay, the next question is from Jill. Jill doesn't live in Edinburgh and she's just wondering if you do virtual appointments and how to organise that.
Yeah, we were talking about that, about getting virtual. There's lots of telehealth can be done. So yes, we're looking to organise it, and we will send an email.
So
Phil
we can,
sort of
I think you
email.
could book appointments. Yeah, you can book appointments on our website, www.physioclinics.scot, or you can get in touch through the website. So yeah, virtual and face-to-face appointments available with Elaine. Um, so this is from an anonymous attendee. Having recently been diagnosed with lichen sclerosis, is there a link between this and pelvic floor not working well? For example, painful sex, anal prolapses. Also, is there a connection with DSP during pregnancy?
Probably not. So lichen sclerosis is a dermatological condition and needs treatment. They will give you various creams to take away the itch and discomfort from it. And it needs monitoring because the cells can change underneath where the lesions are, but it's an external thing. Having said that, having pain and itching and worrying about having something that's just not quite right down below, that can affect your pelvic floor. So your GP would be able to advise you on that. It's not uncommon for women to have these problems and also have a pelvic floor that doesn't relax. So try those stretches, and if it doesn't work, then follow it up with your GP.
Okay, this is another one, an anonymous one. Sorry, not sure how to put this. Should you stop the fart only or contract the front too?
That's a good question. So, if you Google this, then lots of people will tell you to imagine that your pelvic floor is a compass and you're contracting from north, south, east, and west, and you do the points of the clock. There's women can do that. But the reason I say a bit of fart is because we know that most women will get a good contraction from doing that. And if you can feel it at the back, it is working at the front. So sometimes if you don't feel much going on at the front, it's a weakness issue. So if you strengthen it, you should get more sensation.
Okay, there's another one from Anne. Can you put the QR code on so that she can take a picture to
Oh,
access the website?
yes.
So you can put up your last
Sorry,
slide
Anne.
again, that would
There
be
you
good.
go.
And while that's up, we can still do more. So here's another one. For the pelvic floor exercises, is it okay if you clench your buttocks? Web pages guides always say don't, but I can't feel the lift properly unless I'm clenching.
Yeah, that's cheating. So if you're contracting your buttocks, then you'll bounce up and down in your chair, and you won't be contracting the muscles down below. Try doing it in lying, or sometimes women need to lie in their tummy with a cushion or pillows underneath their hips to tip themselves up a bit. See if that helps get the muscles going. Or you can pop something into your vagina and give it a squeeze. The advice tends to suggest that it's your own fingers, but I don't know, see if you can get a willing volunteer. If you're not sure though, then please get referral to come into clinic because you do need to be able to squeeze, and not all women can feel that on their own.
Okay, I think we've got 4 minutes left, so we're going to get as many questions in and before we get cut off. So Claire's got one here. Should you stand or sit to do pelvic floor exercises?
Both. You can do it. It's easier in sitting, it's easier in lying, then in sitting, then in standing. You should be able to engage your pelvic floor anytime. It should be working.
Okay, and can you put the QR code back up, please?
Yes, I can.
A few requests for
I'll
that.
leave it up.
So yeah, just to say that if you have found anything that you'd like to talk to more or discuss with Elaine, you can either organise a virtual appointment or come and visit her in one of our clinics in Edinburgh. We have a few clinics that she's working from. Certainly, is it Leith, and South Gyle, I think, and potentially Fairmile Head in the future.
Female head.
Elaine will
Yeah.
be working from, so make an appointment to come and see her. I think we've got maybe another couple of minutes. So I'll see what else I can get in here. Um, Provided your poos stay the same, do the different types have any significance? For example, if I'm consistently chicken nuggets, is that okay unless I change to porridge or vice versa?
Yeah, so what we want is for you to be somewhere in the middle. So if you've not got smooth like a snake, or if it's painful to pass the poo, then you want to be looking at your diet to change that. The longer that the poo's in in your colon for, the drier it becomes, the harder it is to pass, and then that's more likely to be linked with prolapse. So minor changes are all right, that's just normal. But if it's consistently at the firmer end, then we would worry about that. If it's consistently at the wetter end, then you need to speak to your GP because that's also not within normal.
Brilliant. So I've just had a couple of notes in the chat that the QR code isn't working. So what we will do
Oh,
is, and we're quite new, we're very new to this, so we will try and email you all the QR code, so you'll be able to access the women's health page on the physiotherapy clinics. Our website is www.physioclinics.scot, and Elaine's details are all under the women's health page. But I'm sure we'll be able to email you out the QR code, and also once you're able to access the website, you can get some of the downloads that Elaine talked about, the Bristol stool chart, and the three other documents that we've uploaded for you. But we're coming back again if you've enjoyed it. We've got another one planned for January the 30th, and it's going to be about New Year's resolutions, with exercise and not leaking. So we will send out more details for that in the future. Thank you for your time and hopefully see you again.
thanks very much.
Thank you.